Hi everyone, I'm Dr. Domingo. Welcome to my blog. So today we're going to talk about probiotic use in adults. So in our bodies we've got good bacteria and bad bacteria that live in a balanced system, and when that balance gets disrupted, there's overgrowth of bad bacteria, which then leads to illness and infections. So foods that are rich in probiotics are yogurt, buttermilk, sourdough bread, cottage cheese, pickles, and fermented cow's and goat's milk. In order for probiotics to work well, we need prebiotics, which are a food source for probiotics. And those can naturally be found in onions, raw garlic, bananas, asparagus, oatmeal, and also in wheat bran. There are also symbiotics on the market, and they are supplements that contain both pre and probiotics, but they are relatively new and we don't know them as well as we know probiotics. So probiotics are commonly used when we prescribe short courses of antibiotics for certain conditions. You may have seen when you go to the doctor will prescribe Augmentin and supplement it with a probiotic. The reason for that is antibiotics kill off bad bacteria but also good bacteria, and that then leads to diarrhea in the case of Augmentin, and that's why we supplement it with a probiotic. In women, they tend to get thrush from antibiotics because of the good bacteria being killed off, so we supplement it with a probiotic, and that way we prevent the women from developing thrush. There are quite a few medical conditions that are proven to benefit from long-term use of probiotics. So some of those are inflammatory bowel syndrome. So in Crohn's disease, there's the remission periods tend to be longer with long-term use of probiotics. There's also evidence that probiotics helps with the severity of eczema. It reduces the severity. It reduces lactose intolerance symptoms in lactose intolerant people because the probiotics help for improved metabolism of the lactose. There's also evidence that there's less tooth and gum disease with long-term probiotic use. So there are evidence that are in favor of all of these conditions, but it's not enough for it to be conclusive. The reason why we use them is because the probiotics are relatively safe. It is important, however, to consult with your doctor when you want to use probiotics for any of these conditions, because certain people should not easily just use probiotics. There are people that are more vulnerable, and those are immune compromised patients, cancer patients who are receiving chemotherapy, and also patients who've had recent surgery or suffer from critical illness. So in those patients, their immune systems are not as strong as in a normal person, and they can then suffer from opportunistic infections that the probiotics cause. So it's always important to consult with your doctor before you start any long-term use of probiotics. So my take-home message for today is eat foods that are both rich in pre and probiotics. It's not that hard to find, and if you're thinking about using probiotics long-term, it's best to seek medical advice before starting it. And the last thing is that just because it's on the shelf and it's easily available does not mean that it's safe necessarily. So always consult your doctor first. There was a Swiss physician that lived in the 15th century, Paracelsus, and he said, all things are poisonous, for there's nothing without poisonous qualities. It is only the dose which makes a thing poison. And that's always very important to remember with any kind of medication that you take. Thank you for listening. Feel free to ask me any questions in the comments or send me a message, and please share this with all of your friends on the different social media platforms. Thank you.